Good afternoon, and welcome to the Beyond the Blueprint webinar series. This series empowers health IT professionals with the latest insights, strategies, and design principles required to seamlessly integrate digital tools within their projects. Whether you're embarking on a hospital remodel, constructing a brand new facility, or undertaking a targeted renovation, technology and innovative design are playing an increasing crucial role in shaping the future of healthcare delivery. In this series, we'll explore how to successfully integrate leading-edge technologies and design processes to enhance patient care, optimize operational efficiency, and drive a positive and compelling ROI. My name is Greg Malkery. I'm the Managing Director at Spyglass Consulting. I'm also the host for this series. Joining us today is our guest speaker, Tim Jones, a renowned content creator and Emmy Award winner. He's also the co-founder and CEO of HealthNuts Media, a company specializing in educational content creation targeted at children and family members in order to promote health, literacy, and wellness. Tim, welcome to our webinar. Would you like to provide us with a few opening remarks?
So an opening remark. Okay, how's this? Once upon a time, there was a tortoise and a hare. And the tortoise, you've heard this story before. Okay, well, of course, that's my point. That story is more than 2,700 years old, and it survives to this day. And probably when I said tortoise and hare, many of the people listening to this webcast knew exactly what I was talking about, maybe even jumped in their mind to the end to think about the moral of the story. The slow and steady wins the race. Now, of course, this is great advice, and it may apply in many different situations across the ages, undoubtedly. But the way Aesop told that tale with the tortoise and the hare has a powerful effect on us, and it has lasted this long and been passed down for so long, which I think is a testament to the power of story itself, which is, of course, what we're talking about today. So I've been studying the art and craft and science of story for more than 40 years and have been writing in healthcare for the last 20 years. And I've seen the impact that story has made in healthcare. So I'm really looking forward to this conversation.
Now, before we dive into today's discussion, I want to express my gratitude to our valued sponsors who have made this webinar series possible. We have Lars Anderson from Storage Systems, and we have Keith Washington from Simplify Medical. Lars and Keith, could each of you share a brief welcome and tell us why you're excited to be involved in this series?
Yeah, thanks, Greg. This is Lars Anderson with Storage Systems Unlimited, Director of Sales and Marketing here. So I'm excited about this webinar. Sales and marketing have a lot of storytelling components, but we do a lot of work with new builds, renovations, going in and optimizing storage space in just about every department of a hospital. Have been doing so for the last 40 years. So we provide solutions from carts to cabinets to shelving, and 100 different other, products that you'd find in a healthcare setting. So excited to learn from you, Tim. Quite the story already.
All right. Yeah, and this is Keith Washington, Simplify Medical. Simplify Medical is a point-of-care technology company. We're based in Chicago. We do a number of cart-based platforms. We're one of the manufacturers that we distribute our products through Storage Systems Unlimited, and our mission is to design with care for improving care. So this topic on patient engagement by design is really near and dear to us. So I'll appreciate you being here, Tim. Good. Thanks for joining.
Well, thanks for having me. Appreciate it.
During today's webinar, Tim's going to focus on how storytelling by design can help improve healthcare communications and content creation in order to enhance patient-centered care. Tim, let's get started with the title of the webinar, Patient Engagement by Design, Storytelling in Healthcare. What's so special about storytelling, and why is it particularly important within the healthcare industry?
Yeah, that's a great question. So let's build a little framework. Let's talk about engagement and story, and then we'll put those in the context of healthcare. So, first, engagement. The Merriam-Webster dictionary defines the state of being engaged as emotional involvement or commitment. So, engagement isn't a logical or rational thing so much as it is an emotional thing. Now, from a neuroscience perspective, we know that human beings, strictly speaking, are not rational creatures. We're not computers. You can't just give us data, say, about our healthcare and let us make the calculations based on some perceived optimum best choice and act on those. That's just not how human beings work. David Eagleman, a Stanford neuroscientist, author, and host of a podcast called Inner Cosmos, talks about the human brain not so much as a single entity, but as a team of rivals. He compares this to, say, a parliament with different factions fighting over control over our actions and decisions. So patient engagement, by definition, must connect to multiple neural networks. But how do we do that? So let's talk about story. One theory about the evolution of human language is that it developed specifically so that we could tell stories. Passing information from generation to generation was critical for our survival. Another theory says that we learned to speak and tell stories so that we could talk about each other, and this was fundamental in our tribal relationships and the building of human societies. Stories have been used to tell us what is good and bad, what is desirable and detestable. Our brains take in vast amount of data from our eyes and ears, our tongues, our noses, our skin, and our brain is tasked with taking all of that raw data and converting it into something that we can understand. So in some ways, reality itself is the story we tell ourselves. And so this primal thing we call story is ingrained in us. The structures of our brain may be shaped in part by the evolutionary forces of story. Story works not only on the logical and rational parts of our brain, but on the social and emotional neural networks as well. And that's the framework that I would like to establish for this conversation. How can healthcare systems use storytelling to engage patients and staff?
Can you provide us some insights with more specific healthcare examples to make this more real?
Yeah, sure. Let me try. So, in his book, The Science of Storytelling, Will Storr writes, "We experience our day-to-day lives in story mode. The brain creates a world for us to live in and populates it with allies and villains. It turns the chaos and bleakness of reality into a simple, hopeful tale. And at the center, it places its star, wonderful, precious me, who it sets on a series of goals that become the plots of our lives." And I think this is a really nice synopsis of how the brain creates story to form our own reality. But what happens when you get sick or injured? In her medical memoir, The Invisible Kingdom, Megan O'Rourke describes her decade-long struggle with debilitating chronic illness and healthcare's inadequacy in properly diagnosing and treating her. She writes that when you get seriously ill, either with a chronic illness or a grave disease like cancer, your sense of story is disrupted. The new stories we tell matter because they repair the damage that being sick has done to the ill person's self-understanding. So another author, Arthur Frank, who's a sociologist and narrative researcher, wrote that the body sets in motion the need for new stories when its disease disrupts the old stories, forcing the patient to learn and think differently. But what kind of stories do you tell yourself when you are sick or injured? So Frank believed there were three prevailing narratives in healthcare. The first is what he called the restitution narrative, and that's where the patient overcomes their illness or injury, maybe because of a miraculous medical intervention, and they end up good as new. The second is what he called the chaos narrative, and this is the worst. This is the worst of the three. And in this, the injury or illness just goes on and on forever, sometimes without a proper diagnosis, certainly without not a resolution or a cure or insight. And the patient is just left in this perpetual state of sickness. And then the third is what he called the quest narrative, which is more about transformation than recovery. So in the quest narrative, the patient may not ultimately recover, but through suffering learns important lessons. And so when a patient comes into the healthcare system, they are writing a new story for themselves. And it's important to remember that they are the protagonist, that they are the hero of the story, not the doctor or the nurse or the healthcare organization. But the healthcare organization and everyone involved certainly has their part to play. They become characters and setting and forces within this story that may drive the outcome of this story and certainly how this story is remembered. Now, that's one of the other interesting things about memory and how that is different from a book. When you write a book and open a book to that page, the words on that page will be the same tomorrow and next week and next year and 10 years from now. But memory doesn't really work like that. So we tell ourselves the story of our lives. We're constantly writing the story of our lives. But as time goes by, as we gain more experiences, the memory of what has happened is constantly evolving and changing. So our memory of what happened today will be different tomorrow and next week and next month and next year. And so in the context of our webinar today about telling story with design purpose, it's really important that the healthcare organization understand their role and how these stories are told, and then build an infrastructure and build a culture and build the resources necessary to really have that positive impact on that patient, to help write that story in the best possible way, not only for today and tomorrow, but the way this story will be remembered for weeks and months and years to come.
Tim, let's say I'm a health system who wants to improve patient engagement within the care process. How does storytelling by design work?
Well, that's a big question, isn't it? And probably more than we can answer fully in this 30 minutes, but I'll do my best to give a summary. So first, just remember, there is no one perfect way to tell a story. There is no one perfect plot line or character arc that's going to satisfy every patient in every situation. And in fact, that's what our brains really crave about story. Sure, we love to listen to our favorite stories over and over again, but part of what draws us to story is the surprise and the mystery. Our brain latches on to the conflict of the story and really wants to see a resolution, and that's how story works within our brain. So it's also interesting to think that even though most of us have grown up listening to story, telling story, when it comes to defining story, we're pretty poor at doing that, and it's been the subject of much research and debate over thousands of years. Aristotle wrote about this over 2,000 years ago. Joseph Campbell, Christopher Booker, Robert McKee, all have written about story and what it means. So one of my favorite modern day writers and thinkers on the subject is Robert McKee, who's a Fulbright scholar and began teaching story at the University of Southern California School of TV and Film in the 80s. And one of the ways he starts the discussion is talking about what a story isn't. So we may have learned from Aristotle that, well, a story has a beginning, a middle, and an end. And this is true. But that doesn't mean all things that have beginnings and middles and ends are stories. A story does have that, but it doesn't necessarily work the other way around. For instance, an assembly line has a beginning, middle, and an end, but it is not a story. And most of us can confuse that, and especially in healthcare, this can be a dangerous trap that we fall into. We know the patient is sick or injured, and so we want to describe their journey, a process, a series of things that take them from sick or injured to well. But we have to understand that, again, the human brain is a story processor, not a data processor. So we can't just present this series of things as if it is a story. Now, McKee talks, one way he illustrates this point is to say, if you've ever been listening to someone and they're going on and you're bored out of your mind, you're probably not hearing a story at all. They may be telling you a series of things that happen in a chronological way, but that is not a story. So here's how McKee defines a story. He says, a story is a dynamic escalation of conflict-driven events that cause meaningful change in a character's life. So the conflict within a healthcare setting is probably the injury or the illness or the condition itself. And that is where the patient was going along, living their life, and suddenly they found themselves in this world of healthcare, and they're telling new stories. And so that inciting incident, that thing that happens may be the injury or illness itself. Now, the change is what we're talking about within the healthcare system, the treatments, the medications, the surgeries, the procedures, all of what happens within healthcare is part of that change, and trying to understand that, overcoming fears, making decisions about what that change is, and then ultimately reflecting back to me. What does that mean to me? How does that change my life? What will happen to me? And that, in essence, is how story can be used within healthcare.
Tim, can you give me a specific example where you have personally used this technique to tell stories in healthcare?
Sure. So let me tell you what I would call my origin story, why I started telling and how I started telling story within healthcare. So about 20 years ago, I was running a digital agency in Hollywood, and Starlight Children's Foundation came to us and they said, we're having a really hard time talking to teenagers about cancer and chemotherapy. And I thought, wow, that must be a really difficult thing. At the time, Starlight had a lot of written materials, but that wasn't really engaging, and they found that the teens weren't reading that material. Reality style television was popular, so they'd gone out and shot some video of kids going through their chemo, but other kids watching that, there was maybe too much reality, in that, seeing the other teens get sick and losing their hair, and was just not engaging. And so they thought maybe animation might be a great way, a great mode in which to tell our story, to get the important information across and yet not scare the audience off. And so we worked really long and hard with Starlight, created a series called Coping with Chemo that was told first person. So a young boy and a young girl told parts of their own story, ranging from the day it happened to when they finished their chemo and went into remission. And they had a great story arc, a lot of conflict, a great resolution. And it did really well, really impacted, a lot of people, which I don't always get to see. But in this particular case, a few years later, Starlight invited us. They were having their annual banquet in Beverly Hills, and Steven Spielberg was the chairman emeritus. I believe he still is. That year, Carrie Fisher was the national spokeswoman, and it was a really great event. And at one point, this young girl came up on stage, and she said, when I was 12, they told me I had cancer, and I just gave up. I just thought my life was over, that I was going to die. I was really sad and really depressed, and I didn't know what I was going to do. And someone told me about these videos, and I went and I watched them, and I saw that other kids had gone through what I am going through, and they had fought and they had survived, and it really just gave me the strength and the courage to go through my chemo, and now I'm in remission, and I feel like those videos saved my life. And for me, it was a real light bulb moment. Before that, I'd worked mostly in entertainment, and I thought of story really in terms of entertainment. And now, after seeing the impact that it had made on this one girl, I was convinced that storytelling can be purposeful, that we can do powerful things with story. And that's what started me on my journey. I created HealthNuts Media, co-founded HealthNuts Media about 14 years ago. One of the first things that we did was asthma education. And we knew, and some of the things that we've already talked about, we couldn't just think of our audience as data processors, that they would just we'll tell them everything they need to know about asthma. They'll process that information logically, make all the best choices, and have great income. That are great outcomes. That is not the way human beings work. And so we knew that we wanted to incorporate an element of story to really engage that audience, to help overcome the fears, to deliver the information, to give children a vocabulary of words and terms they did not know, and to do that within a story arc. And so we start with the big bad wolf who goes to blow down the three little pigs' house, and he huffs and he puffs and he has an asthma attack, and the pigs get worried about him and take him into the doctor. And this starts a 7-part series that in each episode we continue that story through the arc. And we started getting great feedback from the nurses who said, previously the old education material that we had was really not very effective. Kids, adults, parents really did not want to engage with what we were giving them. But now with Huff and Puff, we're walking into the room. Maybe they watch these videos 2 or 3 or 4 times. They're smiling. They're relaxed. They still have questions, but our intention was never to answer all the questions. It was really just to facilitate that communication between the provider and the patient, to answer some questions, to engage, but do it in a way that hopefully next week, next month, they'll still remember. They'll think back and go, "Oh, I remember when the big bad wolf and the pig were arguing about asthma and whether it was contagious, and the pig thought maybe he might get asthma from the big bad wolf, but that wasn't true." And they may remember that part of the story and have longer retention and hopefully have better outcomes.
Thanks, Tim. That's interesting, but is there any evidence that digital storytelling in healthcare actually works?
That's a great question, and one that I would really like to know myself. Does storytelling in healthcare really work? Personally, I can say that it does. We've been involved in some academic research studies. We've had some tremendous success with HealthNuts Media, but maybe that sample size is just too small. And of course, I would like to know on a broader scale. So I found a research paper that was published in 2021 called "Storytelling as a Research Tool Used to Explore Insights and as an Intervention in Public Health, a Systematic Narrative Review." And this from the Institute of Health, University College London, sought out to understand how storytelling is being used and how effective it could be. And I'll put a link to the paper in this post in case you would like to read it. But the conclusion was that storytelling reveals insights and serves as an intervention in public health. Benefits of storytelling largely outweigh the limitations, but more follow-up evaluation is needed. Storytelling should play a more significant role in tackling public health issues. And so do the research yourself, go out and see. There's still a lot more work to do, but I truly believe that storytelling can be a very powerful tool for healthcare.
Tim, thank you for sharing your thoughts on how storytelling by design can help improve communications and content creation to enhance patient-centered care. Our discussion today aligns closely with the results in Spyglass's latest market study on digital patient engagement that we published last year. For those of you who are not aware of Spyglass, Spyglass is a product and go-to-market advisory firm focused on disruptive technologies and growth opportunities within the healthcare and life sciences industries. Spyglass has more than 250 customers who are leading technology companies, management consulting firms, healthcare providers, and investment organizations. Spyglass has published more than 30 market research reports on a variety of different informatics-related topics, including mobile computing and communications, digital engagement, telehealth, and clinical surveillance. To explore Spyglass's extensive library of paid research and gain deeper insights into how technology is reshaping healthcare, I encourage you to go to my website at www.spyglass-consulting.com. Well, Tim, I'd like to thank you for sharing your time, insights, and perspectives, and to our sponsors, Storage Systems and Simplify Medical, who made this conversation possible. Tim, would you like to provide us with any closing remarks?
Yeah, thanks, Greg. I really appreciate it. It's been a great conversation today. Obviously, hopefully you can tell that this is very near and dear to me. I love storytelling, and I really am excited about the impact and possibilities that can play in healthcare. So hopefully I've illuminated in the minds of folks out there who may not consider themselves storytellers, at least to start to understand a little bit about what story is and the part that it plays in the minds and the memories of the patients that you serve. I'd like to go back to what we talked about earlier about the three prevailing narratives in healthcare. So we've got the restitution narrative and the quest narrative, and we don't know what path our patients will be on, if they will ultimately recover or not. But hopefully we can do a good job to prepare them for wherever their journey takes them. But what we want to avoid is that third choice that Arthur Frank outlined, which was the chaos narrative, that narrative where the illness or injury seems to go on and on with no enlightenment, with no relief. And we really do not want patients to fall into that chaos narrative. And because healthcare systems are co-authors of that story, they have a lot of power and maybe even obligation to make sure that their patients don't find themselves in a chaos narrative.
Keith and Lars, would you like to share any final thoughts on today's webinar?
No, just appreciate your time and story. It's a good one, and you're obviously good at storytelling as well.
Thanks, Lars. Appreciate it.
Yeah, thanks, Tim. I really appreciate you taking the time. I also I enjoyed learning what stories are not. Right. That's really good. That's really good. That's certainly a lot of let's say presentations came to mind where I didn't really feel like it was as engaging. So appreciate the extra effort and how difficult that is. And also hope you'll come back in the future. Love to hear more about examples. I think that the asthma example was really cool, and just I know there's probably a lot more in your library, and I'd look forward to maybe having those share with our audience.
Sure. Yeah, that sounds great. Well, thanks for having me.
Now, before we conclude today's webinar, I'd like to gather your feedback with a couple polling questions. If you could kindly respond in the comments section below this video. On a scale of 1 to 5, how would you evaluate the effectiveness of your organization's patient engagement efforts, with 5 being the highest? And secondly, how would you assess your organization's commitment to investing in digital tools and technologies to support patient engagement, also on a scale of 1 to 5. At Beyond the Blueprint, we look forward to continuing our conversation with you in future episodes of this series, and I hope that we can invite you back in the future for another informative discussion.